My name is Regan Taylor. I am an internal medicine physician here in the Olson Center. I see a really broad range of patients. My youngest ones are 16. My oldest one currently is 98, so I see a huge range of ages. I see tons of different kinds of problems under the sun. I take care of a little bit of everything, so I'm a little broader spectrum than a lot of the doctors here at the Olson Center. So I take care of lots of chronic diseases like diabetes, heart disease, patients who are cancer survivors, and then just the routine stuff too, like people who come in with colds or the flu and not feeling well. At the Women's Center, we get to be a little bit more focused and worry about diseases that affect women's health a little bit more, are able to pick up on things that affect women differently than they do men. One of the things that is a big selling point about this place is that you can come here and get everything done in one place and not have to travel around to someplace different to get a mammogram and go to a different place to get your DEXA scan. That having everything localized under one roof and one floor, one clinic is really a nice option. And there's the option of getting all those tests scheduled on the same day so that you don't have to make multiple trips back and forth. So I think that's a really nice thing about the clinic. A lot of the people that I've seen that have come in want to be a part of the university system because they know that if things really happen, that we have a lot of access to really good subspecialties and like to have all that localized under one roof. So some people come to us, they already see a heart doctor, maybe already here at university, and they want to change their primary care over and get their other doctors under the same roof so that we can kind of share information in an easier way. So I get a lot of people who just want to come to be a part of the academic center itself. And then at the same time, they also come because they've heard good things about having everything under one roof and that they can get it all kind of the one-stop shopping type thing done. One of the reasons I went into primary care is because I liked the more long-term relationship of that people develop with patients, as opposed to a lot of the specialties and things where you see them for one problem and send a patient on their way. So I like to find out about their families. I like to find out, where they're from, if they're not originally from Omaha. What kind of things did they do? What are their hobbies? And so I like to know those things about people, and it helps me remember them down the road too. But just being able to form those connections. I think it's very important to involve them in their own healthcare decisions. So I'm not the kind of person who gives them orders and says go home and do things. I try to talk with them about, do you think you could do this and make this part of your lifestyle? Are you okay with trying these medications? Do you think this is a good option for you? We could do option A or option B. What do you think? So I try to really involve them more and make them feel like they're getting to take a little initiative in their own healthcare and not just being necessarily told what to do all the time. I feel like I'm pretty accessible, and I think that people should feel comfortable to call me, even if I'm not seeing them in clinic that day, to call and say, hey, this is going on, how can we make this work? Do I need to come in? Is there something we can do to try to work on this? And I guess I just try to be open to people. And I love it when people bring me a list of the questions that they have, because I know it's so many people complain such a short time, and then as soon as the door closes, they think of 10 other questions. So it's always great when they bring me this list of, this is what's going on with me, and also being able to tell me a little bit about what they've had in their past history too. Surgeries and things like that are always helpful to help us to make better healthcare decisions for them, and knowing a little bit about their background. I did my undergraduate training at the University of Northern Iowa. I went to medical school here at UNMC and did my residency, 3 years of internal medicine training here at UNMC.